Alright guys, so we're going to continue with our NIS non-interpretive skills study for the ABR Core Exam. In our initial video, we talked about the principles of professionalism. In this video, I ask, what are the 10 professional responsibilities? Fill in the blanks. Those include professional competence, honesty with patients, patient confidentiality, maintaining appropriate relations with patients, improving quality of care and access to care, just distribution of finite resources, scientific knowledge, maintaining trust, and professional responsibilities. First, commitment to professional competence. Physicians must be committed to lifelong learning of medical knowledge and team skills necessary for the provision of quality care. More broadly, the profession as a whole must strive to see that all of its members are competent and must ensure that appropriate mechanisms are available for physicians to accomplish this goal. 2. Commitment to honesty with patients. Physicians must ensure that patients are completely and honestly informed before the patient has consented to treatment and after treatment has occurred. Medical errors should be communicated promptly to patients whenever injury has occurred. Physicians should be committed to reporting and analyzing medical mistakes to develop appropriate prevention and improvement strategies. 3. Commitment to patient confidentiality. Physicians are responsible for safeguarding patient information. Fulfilling this commitment is more pressing now than ever before, given the widespread use of electronic information systems. However, considerations of public interest may occasionally override this commitment, such as when patients endanger others. 4. Commitment to maintaining appropriate relations with patients. Given the inherent vulnerability and dependency of patients, certain relationships between physicians and patients must be avoided. In particular, patients should never exploit patients for any sexual advantage, personal financial gain, or other private purpose. 5. Commitment to improving quality of care. Physicians should not only maintain clinical competence, but should work collaboratively with other professionals to continuously improve the quality of healthcare, including reducing medical errors, increasing patient safety, improving utilization of healthcare resources, and optimizing outcomes of care. 6. Improving access to care. Physicians should work individually and collectively toward providing a uniform and adequate standard of care and reducing barriers to equitable healthcare. These barriers may be based on education, laws, finances, geography, or social discrimination. This commitment entails the promotion of public health and preventative medicine, without promotion of the self-interest of the physician or the profession. 7. Commitment to just distribution of finite resources. To provide cost-effective health care, physicians should work with other physicians, hospitals, and payers to develop evidence-based guidelines for effective use of healthcare resources. This includes the scrupulous avoidance of superfluous tests and procedures to reduce patient exposure to harm, decrease health expenses, and improve access to resources for patients who need them. 8. Commitment to scientific knowledge. Physicians should uphold scientific standards, promote research, and create new medical knowledge and ensure its appropriate use. The integrity of this knowledge is based on scientific evidence and physician experience. 9. Commitment to maintaining trust by managing conflicts of interest. Medical professionals and organizations can compromise their professional responsibilities by pursuing private gain or personal advantage, especially through interactions with for-profit companies. Physicians have an obligation to recognize, disclose to the general public, and deal with conflicts of interest that arise in the course of their professional duties and activities. Relationships between industry and opinion leaders should be disclosed, especially when physicians are determining criteria for conducting and reporting clinical trials, writing editorials or therapeutic guidelines, or serving as editors of scientific journals. Lastly, 10. Commitment to professional responsibilities. Physicians have both individual and collective obligations to work collaboratively to maximize patient care, be respectful of one another, and participate in the processes of self-regulation, including remediation and discipline of members who have failed to meet professional standards. The profession should also define and organize the educational and standard-setting process for current and future members. These obligations include engaging in internal assessment and accepting external scrutiny of all aspects of the professional performance. Whew, that was a lot to go over, but those are 10 professional responsibilities outlined by the Physician Charter supported by the ABIM. Please subscribe for more videos like this one so we can pass the core exam.